Cénica TV. Cénica TV.
Buen día. Estamos de regreso aquí con Cénica TV y ahorita tenemos aquí con nosotros el doctor David Stukus. David Stukus nos visita desde Colombia, Ohio, es profesor de pediatría allá y viene muy en particular ahorita porque es fellow del Colegio Americano de Alergia, Asma e Inmunología. De hecho, es el vicepresidente del programa de este gran colegio, pues. Dr. Stukus, hi, welcome here with us. And I think what we have some messages here for our public about food allergy and prevention of food allergy, peanut introduction, yes or no, please.
Thank you very much. I'm very happy to be here today to discuss the very exciting new recommendations for us to feed our infants allergenic foods. Now, there are some foods that are more likely to cause food allergy. Peanuts, tree nuts, cow's milk, hen's egg, wheat, soy, and seafood. And for decades, we used to tell parents, don't feed your child these foods until they're 1, 2, or even 3 years old, because we used to think that if we would avoid introducing them to the allergenic foods, that we could prevent them from developing allergy. Interestingly, this was not based on any evidence. This was expert opinion at the time, and it made total sense. However, things change. And we now have excellent evidence from multiple large studies that have all shown the same thing, especially in regards to peanut. The earlier we introduce it to infants and keep it in their diet, we absolutely can decrease the risk for developing peanut allergy as they get older. Now, nothing is 100% effective, and it may require a discussion with your personal physician, but we really want to start changing the message that we have for parents. We want to take away the medicalization of feeding and let them just introduce these foods freely, mostly at home. Now, the guidelines will vary based upon the population and the country that you live in. In the United States, it is recommended that for those infants with very severe eczema or pre-existing egg allergy. Now, infants with severe eczema, which is a chronic rash of itching and red parts of their skin that doesn't get better despite using moisturizers and cortisone, those infants are declaring themselves saying, yes, I am at higher risk of having food allergy and allergies as I get older. So they may warrant our attention. Now, since they're at higher risk of developing food allergy, peanut allergy, we absolutely want to introduce it early to that group especially, but all infants as well. But for that group, we may want to do a very easy peanut allergy test first, just to make sure that we may not cause a severe problem when we introduce it. And oftentimes, the test result really is to help determine whether we want to give it at home or in the office setting. But keep in mind, peanut allergy only affects 1% of the population. So for the vast majority of people, they don't need to worry about it. If your infant otherwise is healthy, has no history of eczema, food allergies, just introduce peanut and other allergenic foods in their diet, beginning around 4 to 6 months of age, but really once they've shown interest and ability to tolerate solid foods. So just start feeding them like you normally would. We certainly don't want to interrupt breastfeeding, and that can go on at the same time that you're introducing complementary foods, and we recommend that. But start with rice cereal, oatmeal, fruit and vegetable purees. Once they're able to chew and swallow those things, then you can start introducing age-appropriate forms of allergenic foods, including peanut. You can do peanut butter thinned with water. There are various peanut flours and peanut powders that you can then mix into foods as well. And then once they're tolerating it, keep it in their diet. Now, keep in mind, with most infants, it requires 6, 7, 10 times for you to introduce a new food, a new taste, a new texture into their diet for them to really like it and take to it. So don't give up. And then, more importantly, if you do notice that they start to develop signs of a food allergy after you're introducing the foods, and this would include immediate onset of big red itchy hives or swelling or things like that, then you absolutely should discuss with their personal doctor whether they need to have allergy testing or avoid that food. But by and large, we want all of our parents out there to have confidence, enjoy the process. Feeding our infants should be a fun and messy experience, and that's okay. But that's the message that we want to get out now. Thank you.
Yeah, Dr. Stukus, this really is, I think, a very mind-changing message that you're giving us. because especially those children with eczema, well, normally the vast majority of our colleagues here in Mexico, they would postpone the introduction of those allergenic foods, especially in this high-risk group. So could you comment a little bit more on this?
Yes, so as allergists, especially and physicians who are treating infants who have eczema or come from families with a history of allergies, it's up to us to really understand the evidence behind this. And if we look at the monumental LEAP study that was published in the New England Journal of Medicine in 2015, they demonstrated very eloquently that when you take these infants with moderate to severe eczema and you introduce peanut prior to 12 months of age, and then keep it in their diet at least 3 times a week, that absolutely can dramatically reduce their development of peanut allergy as they get older. So as providers, it's up to us, 1, to know the evidence and to trust the evidence, and there are other studies as well. 2, communicate these findings with our caregivers and say, listen, your child has eczema. I'm concerned they may develop food allergies. Instead of avoiding these foods, we want to actively introduce it into their diet. And if there's any concern whatsoever, do it in the office setting. This is something that I generally very much enjoy. And I will tell you that now, having done this, really since the LEAP study was published 3 years ago, and over hundreds of infants, they all do extremely well, and they like the taste. So at first they kind of gum their lips, and then they reach for more, and their eyes get very wide. So it's a fun thing to do. And I think the conversation from allergists and physicians needs to change. And it's more than just, oh, be careful. We need to actively have this discussion, actively recommend feed your child these foods. And for general pediatricians, this conversation really should begin at the 2-month visit, 4-month well visit, 6-month well visit, particularly if you start to recognize that they have eczema or other allergic conditions.
Just to really finish this off, so you would recommend to try and start these highly allergenic foods from 4 to 6 months old. You have been doing this, I understand, in your clinic. Could you comment us a bit on how it went? Did you get severe adverse reactions?
So absolutely. We published our data this spring in the Journal of Allergy and Clinical Immunology in Practice, and we found that specifically for peanut, infants with truly severe eczema, covered over most of their body, requiring very high potency topical steroids to control their skin rashes, or pre-existing egg allergy, that we did a peanut skin test first. 70% of them, it was completely negative. So we probably didn't have to do the test in the first place. And in regards to screening and testing, as I mentioned previously, various countries have different thoughts on that in regards to the necessary nature of it. For those infants that fell in sort of the mild-moderate sensitization range, we still introduced it into their diet, and we had very few reactions. Less than 40% had mild symptoms, including a couple of hives on their face or some mild swelling that quickly reversed with treatment with Benadryl. And among those patients, we had only 1 infant who had required epinephrine, and that was somebody who had truly severe eczema and very strong allergy history. But we did it in the office setting, and she quickly improved after she was treated. So out of 120 infants, to have 1 case where we had to give epinephrine shows that this is extremely safe to do, particularly from an allergist perspective.
Those were 120 infants with eczema, not severe eczema. So it was really a highly selected, highly risked group, and you had only 1 major reaction. And it responded very well on epinephrine. Okay. I think, well, this is very interesting new news. If you would like to give a final message to the public.
When it comes to developing trust with parents and caregivers from a physician standpoint, I think we need to understand that evidence changes and the science evolves over time. And now more than ever, we have more publications, more studies, more peer review, and this is a great time to be involved in medicine. But we also need to realize that the evidence often contradicts prior recommendations and prior evidence, and that's okay. But we need to have a thorough understanding of the differences in these and be able to communicate that to all of our parents and caregivers to earn their trust. And really, I think for all of us, just to have an open mind. And just because we've done something one way for years and years and years doesn't necessarily mean that that was the best way to do things.
Thank you very much, Dr. Stuckers. I think this was an amazing interview. Thank you. And thank you for your attention.
Semica TV. Semica TV.